Okay, so my name is B, Xiong Vang, or a lot of people call me Dr. B. I just wanted to be here to talk about a few mental health tips to help you manage some of the struggles that you might be experiencing with mental and emotional challenges. As far as tips go, it's very broad. It just really depends on what you're looking for, what you're struggling with. I tell them that routine is very important. So having something to look forward to, even if it's something little, like, I don't know, your favorite show. Maybe it's ice cream, but scheduling something that you do look forward to, and it doesn't have to be expensive, it doesn't have to be, extravagant. And in fact, you want something that is achievable. Because if you can achieve it, then it actually boosts your motivation to do more. So that is one thing, is just to keep you going. Don't stop, don't just not get up, because that actually is more harmful for your mental health if you're struggling. So anything that you could do to get yourself up and going. I think also something that I often talk to my clients about, especially the first couple of sessions that I have with them, is just the misperception of motivation. I think people get really stuck because they have all these grand plans or ideas about making plans and then carrying it through, and it seems that if they can't get something just right, then they can't seem to start that, and many times that deters them, or that puts them back into like depression or even anxiety, and therefore they don't do anything, and then they stay stuck. So motivation is a misconception, because they think that once they get the motivation, they will get up and do that. And in fact, it works the opposite way, where you have to get up and do it, and then the motivation builds on itself. And once you get the motivation going, it's actually a lot easier to keep it going. So yeah, and I always tell them about, if you think about hauling a big pile of sand, maybe 10,000 pounds of sand, right, from one area to the next. Thinking about that, it's very overwhelming, and it's it feels undoable, but if you think about maybe just setting a goal of doing 3 shovels of sand over per day, what happens is that when people do it, maybe the first time they might do 3 shovels. The second day, maybe they were set out to do 3 shovels, but they end up doing 5 shovels because they were feeling good, and pretty soon that whole sand pile is going to be moved over. Family and friends, I think, do play a very crucial role with somebody who struggles with mental health. Oftentimes, the individual themselves may not be aware, actually, that they are slipping, especially downwards. Oftentimes, if somebody struggles like with depression especially, they will isolate, they will withdraw, it's going to be harder for them to show up to events and things like that. And not always being aware that they are slipping into like a depressive mode. I think this is where friends and family is going to play a role, and just making sure that your loved ones are staying engaged, especially if you know that they are susceptible to bouts of depression. Then if you start noticing these little things, it's going to be important to just reach out to them, and not just say, do you need something? Do you, can I help you or anything like that? But actually get them to go do something with you, or get them to talk to you, open up in some kind of way, or just be with them. I think many times that does do the trick too. It's better. They might not want you to, because again, they are slipping into that depressive mode, and people aren't always self-aware of what is happening. They get kind of swallowed up by some of their thoughts and feelings that they don't always realize what is happening. So as an outsider, if you are noticing that, it's important that you step in and you do some of those things for them, or just be with them. Even if they don't want that, sometimes it actually does more good for them than they realize. I do think that hobbies or having interests is going to help with mental health for a number of reasons. First of all, it keeps you engaged, it keeps you motivated, but it also provides an opportunity to build connections, to build belongingness. And the more connected people feel, the more competent they feel in something, the more excited they feel about something, the better off they're going to be mentally and emotionally. So definitely, I think building, having some hobbies or activities that they are involved in is definitely going to help with that. And of course, like that social aspect too, especially if your activity or hobby involves other people. I think that network, also keeps you going. So I think, overall activities and hobbies are definitely important. So sleep is so important, and I cannot stress that enough. I'm a testing psychologist. So what I do with testing is I assess what is going on cognitively, socially, mentally, emotionally, and then I formulate the case, right, about like what is going on with this individual. I diagnose, and then I provide them with feedback and recommendation on what it is that needs to happen for this individual. What I will say is that sleep, when somebody is struggling with adequate sleep, maybe they can't fall asleep, maybe they're not getting enough sleep, they're having disturbed sleep due to like nightmares or whatnot, this throws off everything. This is also true in therapy clients too. So we cannot get a good and accurate assessment of what is happening with the individual until we can ensure that they are sleeping as best as they can. If it is true that they are just struggling with sleep because of a sleep issue, then we would want to get that checked out medically, just to make sure that there isn't something going on physically that is preventing them from sleeping. And if that checks out, and they're still having troubles with sleep, then that's when we could figure out, okay, is this a sleep disorder that we're talking about here, or is the sleep being caused by significant mental health challenges? And so that's where we could start deciphering what's going on. But if you don't have good sleep, the rest of the pieces aren't gonna fall in place, or at least it's not gonna be clear what is causing the issues. So just to give you a more concrete example, so my role in testing, I often see clients that come in that complain about anxiety, depression, and especially attention issues. They can't seem to pull their life together, they can't seem to maybe go to school, they can't seem to function at work, and they're like, I think I have ADHD. Whenever we assess things like this, we cannot accurately figure out, is this ADHD? Like, is your trouble really with inattention and problems with concentration and focus, or is it sleep? So once we figure out, okay, we need to figure out the sleep issue, get you on a regular sleep routine, and getting you feeling better, then we can say, okay, so the attention and focus problems still persist. So that can be a whole different issue by itself then that's what we're gonna treat. So sleep definitely impacts the rest of your life. So exercise, similar to sleep, is highly recommended. Not everyone has the time or prioritizes exercising. But I would say that if you go talk to any mental health provider, the same as you would go talk to any healthcare provider, they're gonna stress the importance of exercise, right? Exercise doesn't necessarily have to be rigorous, but it could be just going out for a walk. Something that is focusing on your health and physical well-being, that is so important in your mental health. So definitely exercise is important, and it gets you, similar to what I said before, you need to do something that's going to help your body stay active or get you going. Exercise does that too. It builds, just the energy and motivation to keep you going. It also boosts really good, what we call neurotransmitters. So, things in your body that is gonna make you feel better about, yourself and who you are, give you energy. And so, yeah, definitely exercise is important for mental health. Something that I've, especially with my clients who are anxious, or even if you just pay attention to yourself, anytime that you feel a little bit more anxious or you feel uptight about something, you might not always notice it, if you're not mindful or in tune with what's happening in your body. But if you pay attention, your breathing actually changes. Your heart rate actually changes, and without you realizing this, these are just automatic in your body. So definitely the way that you breathe is going to help with you modulating different moods and emotions that you're experiencing. What I find is, for my clients who have struggles with anxiety or panic attacks, their bodies are changing in that moment without them realizing it. And so just by incorporating breathing techniques in, it could actually help slow what's happening in their body, and they could actually kind of come out of it. So what I really recommend is this is very simple. I'll just show you. Recommend putting your hand on your belly just to kind of make sure that you're breathing from your diaphragm and not just in your chest area, because that's shallow breathing. The shallow breathing could actually exacerbate the anxiety that you're experiencing. So you definitely want the deeper, like when you're singing, you want the deeper breath that you're getting. And I put one on my chest just to make sure that the right hand, the correct hand is rising. Okay, so you just do 1, 2, 3 in, and then 1, 2, 3 out. So something like, and making sure that it's your diaphragm that is filling up. I would say that even like the rhythm in which you breathe is gonna make a difference. For some people, the general I use is 1, 2, 3 in, 1, 2, 3 out. But for some people, maybe they're more comfortable with 1, 2, 3, 4 in, 1, 2, 3, 4, 5 out. So it just depends on what you're comfortable with, but definitely slowing down your breathing and making sure that you're filling up your diaphragm is the key pieces here. That's going to help with modulating your emotions, your anxiety in that moment. Okay, so I just want to briefly talk about the importance of finding a good fit for you as the person who is maybe seeking out services for yourself. I have worked with a variety of different clients, and what I do find, especially in our Hmong clients, is that when they seek other providers, of course they can help with the mental health aspect, but the individual who might be of a different culture, they find that it can be challenging because the other person isn't as familiar with the nuances of your culture, the way of life, the different gender roles, for example, that you might have to endure in your own culture. So I do find that in my experience, when somebody finds a right fit for themselves, that therapist is able to see all of them, understand all the nuances of what they're going through, not just with mental health and mental and emotional health, but also in their own lives, and helping them navigate some of those very challenging factors that other healthcare providers or mental health providers might not always be aware of. So I do really encourage you to find somebody who you find to be a good fit for you, who could really understand where you're coming from, because I do think that makes all the difference in your own mental health journey as you figure out all of this. It's very challenging, and so the more support you have in your area or your arena, I think that you're going to be much better off.